Victory Frankl's Man's Search for Meaning, Part 2, Logotherapy, Life Transitoriness. Those things which seems to take any meaning away from human life include not only suffering but dying as well. I never tired of saying that the only really transitory aspects of life are potentialities, but as soon as they are actualized, they are rendered realities at that very moment. They are saved and delivered into the past, wherein they are rescued and preserved from transitoriness. For in the past, nothing is irretrievably lost, but everything irrevocably stored. Thus, the transitoriness of our existence in no way makes it meaningless, but it doesn't constitute our responsiveness for everything hinges upon our realizing the essentially transitory possibilities. Man constantly make his choice concerning the mass of present potentialities. Which of these will be condemned to non-being and which will be actualized? Which choices will be made and actuality once and forever and immortal? Footprints in the sand of time, at any moment man must decide for better or for worse what will be the moment of his existence. Usually, to be sure, man considers only the subtle field of transitoriness and overlooks the full granaries of the past, wherein he had salvaged once and for all his deeds, his joys, and also his sufferings. Nothing can be undone, and nothing can be done away with. I should say, having been in the surest kind of being. Logotherapy, keeping in the mind essential transitoriness of human existence, is not pessimistic, but rather than activistic. To express this point figuratively, we might say the pessimist resembles a man who observes with fear and sadness that his wall calendar, from which he daily tears a sheet, grows thinner with each passing day. On the other hand, the person who attacks the problems of life actively is like a man who removes each successive leaf from his calendar and files it neatly and carefully away with its preceders. After first having jotted down a few diary noted on the back, he can reflect with pride and joy on all the richness set down in these notes and all the life he has already lived to the fullest. What will it matter to him if he notices that he is growing old? Has he any reason to envy the young people whom he sees or wax nostalgic over his own lost youth? What reasons has he to envy a young person? For the possibilities that a young person has, the future which is in store for him. No, no, thank you. He will think instead of possibilities, I have realities in my past. Not only the reality of work done and of a loved one, but of suffering bravely suffered. This suffering are even the things of which I am most proud. So these are things which cannot inspire envy. Logotherapy as a technique. A realistic fear, like the fear of death, cannot be tranquilized away by its psychodynamic interpretation. On the other hand, a neurotic fear, such as agoraphobia, can't be cured by philosophical understanding. However, logotherapy has developed a special technique to handle such cases too. To understand what is going on whenever this technique is used, we take as a starting point a condition which is frequently observed in neurotic individuals, namely anticipatory anxiety. It is characteristic of this fear that it produces precisely that of which the patient is afraid. An individual, for example, who is afraid of blushing when he enters a large room and faces many people will actually be more prone to blush under these circumstances. In this context, one might aim the saying, the wish is father to the thought. The fear is mother of the event. Ironical, ironically enough, in the same way that fear brings to pass what one is afraid of, likewise, a force intention makes impossible that only possible wishes. This excessive intention or hyperintention, as I call it, can be observed particularly in case of sexual neurosis. The more a man tries to demonstrate his sexual potency or a woman her ability to experience orgasm, the less they are able to succeed. Pleasure is and must remain a side effect by product and is destroyed and spoiled to the degree to which it is made a goal in itself. In addition to excessive intention as described above, excessive attention or hyperreflection, as it is called in logotherapy, may also be pathogenic. The following clinical report will indicate what I mean. A young woman came to me complaining of being frigid. The case history showed that in her childhood she had been sexually abused by her father. However, it had not been traumatic experience in itself which had eventuated in her sexual neurosis as could easily be evidenced. For it turned out that through reading popular psychoanalytic literature, the patient had lived constantly with the fearful expectation of the toll which her traumatic experience would someday take. The anticipatory anxiety resulted both in excessive intention to confirm her femininity and excessive attention centered upon herself rather than upon her partner. This was enough to incapacitate the patient for the peak experience of sexual pleasure. Since the orgasm was made an object of intention, an object of attention as well, instead of remaining an unintended effect of unreflected dedication and surrender to the partner. After undergoing short term logotherapy, the patient's excessive attention and intention of her ability to experience orgasm has been dereflected. To introduce another logotherapeutic term, when her attention was refocused towards the proper object, that is, the partner, organism establishes itself spontaneously. Logotherapy base is technique called paradoxical intention on the twofold fact that fear brings about that which one is afraid of, and that hyperintention makes impossible what one wishes. In German, I describe paradoxical intention as early as 1939. In this approach, the phobic patient is invited to intend, even if only for a moment, precisely that which he fears. Let me recall a case. A young physician consulted me because of his fear of perspiring. Whenever he expected an outbreak of perspiration, this anticipatory anxiety was enough to participate excessive sweatings. In order to cut this circle formation, I advise the patient in the event that sweating should recur to resolve deliberately to show people how much he could sweat. A week later, he returned to report that whenever he met anyone who triggered his anticipatory anxiety, he said to himself, I only sweat out a quart before, but now I am going to pour at least 10 quarts. The result was that, suffering from his phobia for 4 years, he was able, after a single session, to free himself permanently of it within 1 week. The readers will note that this procedure consists of a reversal of the patient's attitude inasmuch as his fear is replaced by a paradoxical wish. By this treatment, the wind is taken out of the sails of the anxiety. Such a procedure, however, must make use of the especially human capacity for self detachment inherent in a sense of humor. This basic capacity to detach one from oneself is actualized whenever the logotherapeutic technique called paradoxical intention is applied. At the same time, the patient is enabled to put himself at a distance from his own neurosis. A statement consistent with this is found in Gordon W. Alport's book, The Individual and His Religion. The neurotic who learns to laugh at himself may be one on the way of self management, perhaps to cure. Paradoxical intention is the empirical validation and clinical application of Alport's statement. A few more cases reports may serve to clarify this method further. The following patient was a bookkeeper who had been treated by many doctors and in several clinics without any therapeutic success. When he was admitted to my hospital department, he was in extreme despair, confessing that he was close to suicide. For some years, he had suffered from a writer's cramp, which had recently become so severe that he was in a danger of losing his job. Therefore, only immediate short term therapy could alleviate the situation. In starting treatment, Dr. Eva Cosdera recommended to the patient that he do just the opposite of what he usually had done. Namely, instead of trying to write as neatly and legibly as possible, to write with the worst possible scrawl, he was advised to say to himself, now I will show people what a good scribble I am. And at the moment in which he deliberately tried to scribble, he was unable to do so. I tried to scroll but simply could do not it, he said the next day. Within 48 hours, the patient was in this freed from his writing Writer's cramp and remained free for the observation period after he had been treated. He is a happy man again and fully able to work. A similar case dealing, however, with speaking rather than writing was related to me by a college colleague in the Lycanological department of the Vienna Polyclinic Hospital. It was the most severe case of stuttering he had come across in his many years of practice. Never in his life, as far as the stutter could remember, had he been free from his speech trouble, even for a moment, except once. This happened when he was 12 years old and had hooked a ride on a streetcar. When caught by the conductor, he thought that the only way to escape would be to elicit his sympathy, and so he tried to demonstrate that he was just a poor stuttering boy. At that moment, he tried to stutter. He was unable to do it. Without meaning to it, he had practiced paradoxical intention, though not for therapeutic purposes. However, this presentation should not leave the impression that paradoxical intention is effective only in monosympathetic cases. By means of this logotherapeutic technique, my staff at the Vienna Polyclinic Hospital has succeeded in bringing relief even in obsessive compulsive neurosis of a most severe degree and duration. I refer, for instance, to a woman 65 years of age who had suffered for 60 years from a washing compulsion. Dr. Eva Kosdera started logotherapeutic treatment by means of paradoxical intention, and 2 months later, the patient was able to lead a normal life. Before admission to the neurological department of the Vienna Polyclinic Hospital, she had confessed life was hell for me, handicapped by her compulsion and bacteriophobic obsession. She finally remained in bed all day, unable to do any houses work. It would be accurate to say that she is now completely free of symptoms from an obsession may come to her mind. However, she is able to joke about it, as she say, in short, to apply paradoxical intention. Paradoxical intention can be also applied in cases of sleep disturbances. The fear of sleeplessness results in a hyperintention to fall asleep, in which in return incapacitates the patient to do so. To overcome this particular fear, I usually advise the patient not to try to sleep but rather to try to do just the opposite, that is to stay awake as long as possible. In other words, the hyperintention to fall asleep arising from the anticipatory anxiety of not being able to do so must be replaced by the paradoxical intention not to fall asleep, which soon will be followed by sleep. Paradoxical intention is no panacea, panacea, yet it lends itself as a useful tool in treating obsessive, compulsive, and phobic conditions, especially in case with underlying anticipatory anxiety. Moreover, it is a short-term therapeutic device. However, one should not conclude that such a short-term therapy necessarily result in only temporary therapeutic effects. One of the more common illusions of Freudian orthodox, to quote the late Emily A. Guthel, is that the durability of results corresponds to the length of their apply therapy. In my files, there is, for instance, the case reports of patients to whom paradoxical intention was administered more than 20 years ago. The therapeutic effect proved to be nevertheless a permanent one. One of the most remarkable facts is that paradoxical intention is effective regardless of the etiological basis of the case concerned. This confirms a statement once made by Edith Weisskopf Joelson. Although traditional psychotherapy has insisted that therapeutic practices have to be based on finding an etiology. It is possible that certain factors might cause neurosis during early childhood and that entirely different factors might relieve neurosis during adulthood. As for the actual causes of neurosis apart from constitutional elements, whether somatic or psychic in nature, such feedback mechanism as anticipatory anxiety seems to be a major pathogenic factor. A given symptom is responded to by a phobia, the phobia triggers the symptom, and the symptom in turn reinforces the phobia. A similar chain of events, however, can be observed in obsessive compulsive cases in which the patient fights the ideas which haunts him. Thereby, however, he increases their power to disturb him. Since pressure precipitates counter pressures, again the symptom is reinforced. On the other hand, as soon as the patient stops fighting his obsession and instead tries to ridicule them by dealing with them in an ironical way, by applying paradoxical intention, the vicious circle is cut, the symptom diminishes and finally atrophies. In the fortunate case where there is no existential vacuum which invites and elicits the symptoms, the patients will not only succeed in ridiculing his neurotic fear but finally will succeed in completely ignoring it. As we see, anticipatory anxiety has to be counteracted by paradoxical intention, hyperintention, as well as hyperreflection had to be counteracted by dereflection. Dereflection, however, ultimately is not possible except by patience, orientation toward his specific vocation and mission in life. It is not the neurotic self concern, whether pity or contempt, which breaks the circle formation. The cue to cure is self transcendence. The collective neurosis. Every age has its own collective neurosis, and every age needs its own psychotherapy to cope with it. The existential vacuum, which is mass neurosis of present time, can be described as a private and personal form of nihilism. For nihilism can be defined as the contention that being has no meaning. As for psychotherapy, however, it will be never be able to cope with his state of affairs on a mass scale if does not keep itself free from the impact and influence of the contemporary trends of a nihilistic philosophy. Otherwise, it represents a symptom of the mass neurosis rather than its possible cure. Psychotherapy would not be reflect a nihilistic philosophy but also even to unwillingly and unwittingly transmit to the patient what is actually a caricature rather than a pure true picture of a man. First of all, there is a danger inherent in the teaching of man's nothing but ness. The theory that man is nothing but the result of biological, psychological, and sociological condition or the product of heredity and environment. Such a view of a man makes a neurotic believe that he is prone to believe anyway, namely that he is the pawn and victim of outer influence or inner circumstances. This neurotic fatalism is posted and strengthened by a psychotherapy which denies that man is free. To be sure, a human being is a finite thing and his freedom is restricted. It is not freedom from conditions, but it is freedom to take a stand towards the conditions. As I psychiatry, I am fully aware of the extent to which man is subject to biological, psychological, and sociological conditions. But in addition to being a professor in two fields, I am a survivor of four camps, concentration camps. That is, and as such as also be a witness to the unexpected extent to which man is capable of defying and braving even the worst condition conceivable. Critique of pan determinism. Psychoanalysis has often been blamed for its so-called pansexualism. I, for one, doubt whether its reapproach has never ever been legitimate. However, there is something which seems to me to be an even more erroneous and dangerous assumption, namely that what I call pan determinism. By that I mean the view of man which disregards his capacity to take a stand towards any conditions whatsoever. Man is not fully conditioned and determined, but rather determines himself whether he gives into condition or stands out to them. In other words, man is ultimately self determining. Man does not simply exist but also decides what his existence will be, what he will become in the next moment. By the same token, every human being has the freedom to change at any instant. Therefore, we can predict his future only within the large framework of a statistical survey referring to a whole group. The individual's personality, however, remains essentially unpredictable. The basis for any predictions would be represented by biological, psychological, or sociological conditions. One of the main features of human existence is the capacity to rise above such conditions to grow beyond them. Man is capable of changing the world for the better if possible, and of changing himself for the better if necessary. Let me cite the case of Dr. J. He was the only man I ever encountered in my whole life whom I dare to call a Mephistophelian being, a satanic figure. At this time, he was generally called the mass murderer of Steinhoff. When the Nazis started their euthanasia program, he held all the strings. in his hand and was so fanatic in the job assigned to him that he tried not to let one single psychotic individual escape the gas chamber. After the war, when I came to back to Vienna, I asked what had happened to Dr. J. He had been imprisoned by a Russian in one of the isolation cells of the Steinhof, they told me. The next day, however, the doctor of his cell stood upon and Dr. J was never seen again. Later, I was convinced that, like others, he had, with the help of his comrades, made his way to South America. More recently, however, I was consulted by a former Austrian diplomat who had been imprisoned behind the Iron Curtains for many years, first in Siberia and then in the famous Lubenka prison in Moscow. While I was examining him neurologically, he suddenly asked me whether I happened to know Dr. J. After my affirmative reply, he continued, I made his acquaintance in Lubenka. There he died at about the age of 40 from cancer of the urinary bladder. Before he died, however, he showed himself to be the best comrade you can imagine. He gave consolation to everybody. He lived up to highest conceivable moral standards. He was the best friend I ever met during my long years in prison. This is the story of Dr. J, the mass murderer of Steinhof. How can we dare to predict the behavior of man? We may predict the movement of a machine, of an automation, more than this. We may even try to predict the mechanism or dynamisms of the human psyche as well. But man is more than psyche. Freedom, however, is not the last word. Freedom is only part of the story and half of the truth. Freedom is but the negative aspect of the whole phenomenon, whose positive aspect is responsibleness. In fact, freedom is danger of the degenerating into mere arbitrariness unless it is lived in terms of responsibleness. That is why I recommend that the Statue of Liberty on the East Coast be supplemented by a Statue of Responsibility on the West Coast. The psychiatric credo. There is nothing conceivable which would so condition a man as to leave him without a slightest freedom. Therefore, a residue of freedom, however limited it may be, is lifted to a man in neurotic and even psychotic cases. Indeed, the innermost core of the patient's personality is not even touched by a psychosis. An incurably psychotic individual may lose his usefulness but yet retain the dignity of a human being. This is my psychiatric credo. Without it, I should not think it worth while to be a psychiatrist. For whose sake? Just for the sake of a damaged brain machine which cannot be repaired? If the patients were not definitely more, enthusiasm will be justified. Psychiatry rehumanized. For too long a time, for half a century, in fact, psychiatry tried to interpret the human mind merely as a mechanism and consequently the therapy of mental disease merely in terms of a technique. I believe this dream has been dreamed out. What now begins to loom on the horizon are not the sketches of a psychologist's medicine, but rather those of humanized psychiatry. A doctor, however, who would still interpret his own role mainly as that of a technician, would confess that he sees in his patients nothing more than a machine instead of seeing the human being behind the disease. A human being is not the one among others. Things determine each other, but man is ultimately self determining what he becomes within the limits of endowment and environments he has made out of himself. In the concentration camps, for example, in this living laboratory and on this testing ground, we watched and witnessed some of our comrades behave like swine while others behave like saints. Man has both potentialities within himself. Which one is actualized depends on decision but not on conditions. Our generation is realistic, for we have to come to know man as it really is. After all, man is that being who invented the gas chamber of Auschwitz. However, he is also the being who entered those gas chambers upright, with the Lord's Prayer or the Shema Israel on his lips.